The chairperson of the Portfolio Committee on Health, Dr. Sibongiseni Dhlomo, has said reports that the National Health Insurance NHI Bill has been suspended are false and untrue. Dr. Dhlomo said he's alarmed at a letter circulating in the public domain which indicates that the committee has suspended the process pending advice from the state legal advisor on the constitutionality of the bill. The chairperson of the Portfolio Committee on Health, Dr. Sibongiseni Dhlomo, joins me now live from our studios in Parliament. Dr. Dhlomo, good afternoon to you. Thank you so much for coming through. Firstly, what exactly does this meeting say, and do we know the source of this meeting message?
Thank you very much. I have a problem with my voice this afternoon.
It's okay.
No, there has been a letter circulating in the media purported to be drafted by Mr. Neil Kirby of a particular attorney company. We dissociate ourselves from that because this man cannot speak on behalf of a department and on behalf of the Portfolio Committee of Health.
But do we know who this Mr. Neil Kirby is? Do we know who he is? Is he in any way associated with the department or the Portfolio Committee?
No, he's not associated with the Portfolio Committee of Health. He's not known to us. He's also not known to the Department of Health. He is probably one of those mischievous South Africans who wants to derail our process. So we have not really been able to make contact with him. But in his letter, he has given his particulars of a particular firm of a company, of attorneys that he's working for.
So, do you suspect, Dr. Dhlomo, that this message that's been circulating could be intentional in sort of causing confusion amongst the people? Because we do know that the bill has certainly received a mixed reaction from the people.
Ma'am, this coming Thursday, I'm chairing a meeting of the Portfolio Committee of Health. Dr. Zwelim Kize is coming in to take us through as a portfolio committee, because as you would know now, the minister brought this to the parliament. Therefore, we are the responsible committee to process it, including having public hearings. That's when is the process going to kick in. We are going to be making an advert indicating to all South Africans where we are going to have public hearings, inviting them to come and make their presentations. So there's no truth that the process has been suspended. I might add that I have had meetings with the state law advisor, because there are some South Africans who have been saying that this bill is probably unconstitutional and they would want to take this to the Constitutional Court. I'm aware that the Department of Health too, in drafting this bill, we're consulting with lawyers. We also have had a briefing from our own lawyers here in Parliament. So I do not fear a process of going forward with this bill, waiting for state law advisors, who otherwise will join us anyway in the meeting on Thursday. So we have no suspension of the bill process.
All right, so you say that the committee is certain on the constitutionality of this bill. I mean, we've had the likes of the Democratic Alliance saying that they are willing to challenge this bill, as you said, going as far as to the Constitutional Court.
Look, I'm not a lawyer. All I'm saying that we have received a legal advice on this process. If they think they will take it up for challenging with their own lawyers, maybe they are correct, that then they will take it to the Constitutional Court. But we cannot hold processing this bill because of the threat and the desire of the DA. We have a process to take through to the South Africans. If they are unhappy with that, then they are right to do whatever they want to do.
All right. So the process of the bill has been tabled in the National Assembly. The Speaker has presented and referred it to your committee. The public hearings, when are they likely to take place, as you say that the advert would be out soon?
If we are following the parliamentary process, if this bill has been tabled to us on Thursday by Dr. Zweli Mkhize and this department, I've already initiated a process to request the chair of chairs to grant us the permission to advertise this bill and make it for public people to come forward, read it, access it, and that is a process that must take 30 days. After 30 days, we will then be given space to start doing public hearings. We will be starting, I don't know which province, but there's no province that will be left unattended to. We'll also be opening up space for other stakeholders to write to us, indicate that they would like to come and make oral submissions, and the process will kick in. We are not anticipating that this process will be an unending program, because the fifth parliament did start on this process. So it's not a very new bill to South Africans. And a lot of people out there are waiting to see the completion of this work.
All right, Dr. Dhlomo, I think we should leave it at this. We don't want to strain your voice any further. Speedy recovery. Thank you so much for coming through. Well, there you have it. That's Dr. Sibongiseni Dhlomo. He's the chairperson of the Portfolio Committee in Health in Parliament, of course, really clarifying the message that's been doing the round, saying that the NHI Bill has been suspended. The doctor saying that the claims are false and untrue.